Victoria should have gone into a New Zealand-style stage 4 lockdown at least a week ago. That's according to Australian Medical Association President, Professor Julian Rait, who says public health messages aren't getting through and stricter messages need to be adopted before the virus gets out of control. He wants masks compulsory throughout the state and construction sites and workplaces shut down except for essential workers.
The tough times we're experiencing in Victoria is because we really haven't locked down hard enough to actually restrict people's movements. The AMA in Victoria recommended approximately 6 days ago that we need to move to a New Zealand-style stage 4 lockdown. And there's a feeling now that, of course, with cases still rising, that might be necessary. I can understand the natural reluctance of government perhaps to embrace that because of the economic consequences, but we seriously feel that unless there's additional measures taken to restrict movement and particularly reduce the amount of people who are in various different workplaces, we think that the cases may still become more and more difficult for the hospital system to manage.
So worst case scenario, without more strict restrictions, what do you anticipate could happen? Have you reached the peak?
Well, I don't think so. I mean, I think that the replication rate, which is obviously the rate at which the virus is replicating in the community, has probably been reduced by the measures that were introduced just over 2 weeks ago. But I think that the problem is that the replication rate is not below the magic number of 1, and as a result, we're still seeing the cases rising. For example, on the 3rd of July, we had 77 cases. On the 10th of July, we had 288 in Melbourne. And then last Friday, we had 428. And, just yesterday, we had 484. So the trend seems to be drifting upwards, even though it might be not increasing quite as much as it did at first before the restrictions. But nevertheless, that has the potential to overwhelm our hospital system. We're some way off actually having our hospital beds and our ICUs overwhelmed. We estimate that that would take possibly up to 1,600, 1,700 cases a day for a week to 10 days to do that. So we're some way off our capacity in that regard being compromised. But what we're concerned about is the increasing number of healthcare workers who are becoming infected. And this means that those particular staff and their contacts have to be removed from the workplace, and that's creating some considerable stress already on rosters in a number of our frontline hospitals. In fact, we had a few of them on bypass the other day, which was very concerning because those seem to be the ones mainly in the areas where the most cases were arising.
What is not happening at the moment? Or let me put it another way. What are people allowed to do right now that you don't think they should be?
Well, I think that the key is that a number of people are defining themselves as quote-unquote essential workers, which wouldn't have applied under the definition that you used in New Zealand under your stage 4 lockdown. As I understand, you shut down pretty much all businesses except pharmacies, clinics, supermarkets and grocery stores, etc. But we still have construction sites where there are numerous people working, often commuting in and out from the outer suburbs into these work sites or even into areas outside our so-called lockdown zone, into regional towns and communities. And we're very worried that could be a problem, particularly because 80% of all infections identified since the 1st of July have occurred in workplaces. Now, some of those workplaces, of course, might well have been aged care homes or indeed hospitals, but a great many others have occurred in other workplaces, perhaps Bunnings Warehouse, for example, hardware stores or that sort of thing. And it's just these sorts of other workplace environments that, while they might be essential for normal commerce and activity, they could also potentially be places where the virus is spreading amongst the workforce. So our view is that a stage 4 style lockdown, which restricts people's movement even further, would really be desirable now to try and contain this unfortunate pandemic that's roaring through Melbourne.
Your Premier has expressed, I suppose, a degree of frustration that people just simply aren't following the rules. How can you change that kind of behaviour? How can you encourage people to get on board?
Well, that's a great question, Lisa. I think that if 90% of symptomatic people are not isolating prior to testing and only 54% isolating before they get a test result, then it may be very difficult to to change such behaviour, because clearly the public health messages haven't got through to those people that they're posing a risk to the community. And I think that's why the AMA believes it's very important that we consider harder lockdown measures, because I think that would reduce people's propensity to be out and about while they're waiting for a test, because it would generally restrict movement further. So I guess that and the AMA is not really that optimistic that behaviour can be turned around very quickly unless more strict measures are adopted.
So you have to wear masks now. Is that just in the city as such, or if you were going to more rural areas in and around Melbourne, would you also have to wear a mask?
No, it's just within the confines of the metropolitan area and what's called the Mitchell Shire, which is a sort of like an extended part of the suburban Melbourne, which extends north along the Hume Highway. So there is no compulsion to use masks outside that zone. And again, I'm very nervous about that, because we know that people commute in and out from those satellite towns like Ballarat, Bendigo, Geelong, and obviously are moving freely from the place around Melbourne that has places in around Melbourne that have higher levels of infection back into their own communities and potentially could be spreading it. So mask use would be very much, or it's been very much encouraged by us in those areas, but we think they should probably be mandated.
It sounds like from what you're saying that you think most of these measures are kind of half pie, halfway there, but not full enough, not strict enough.
Precisely. When you've got a virus that's as infectious as this, you can't have halfway measures. I think the experience that you had in New Zealand proved that if you actually go out and try and get out in front of the virus, notwithstanding that you still have some risks from returning travellers and other things, but if you can actually lock down things and get out ahead of the virus and be almost preemptive in your decision-making, painful though it may be, it is more likely to pay off. And I can only just reflect on some work I did many years ago as a young fellow in the United States. I did some research about our flu pandemic in Australia in 1919. We did a bit better than New Zealand back then, and interestingly, there was a lot of strict measures adopted very early in some cities, and indeed in the United States, in very many cities where they had a more robust public health response, where they pretty much shut down everything. There was a much greater success at curtailing the epidemic and reducing the number of infections and deaths. So history has shown that a harder and firmer lockdown may well pay dividends in the longer term.
Is more weight being given to economic outcomes than it is to health outcomes?
Well, that's the AMA's suspicion. I mean, it's hard to put a finger on it, but we think that's the case. Now, obviously, at this point, I'm not sure whether we can, even with a stage 4 lockdown, eliminate the virus in Melbourne in a reasonable time as you did in New Zealand. But nevertheless, we think that just to contain the current outbreaks and to reduce the replication rate, we think that something akin to that's going to be necessary. And even though masks will help, because they probably reduce transmission by about up 69-70% or something, according to recent studies, we feel that really these workplace infections and preventing people gathering in enclosed spaces where there could be aerosol spread is really important to trying to curtail the replication of the virus and the spread in the community. And I think, personally, a New Zealand-style hard lockdown for a shorter period of time would be less painful. Difficult though it might be to accept that, I think a more prolonged and lighter lockdown is counterproductive. So getting on top of this earlier with a harder lockdown and possibly emerging sooner would appear to me to be a better strategy.
And that's Australian Medical Association President Professor Julian Rait.